Good afternoon. Welcome to the Thurston County Board of Health meeting for Tuesday, May 11th, 2021. It is 3:50 p.m. My name is Ty Menser, Chair of the Board. We have Vice Chair Commissioner Carolina Mejia, as well as Commissioner Gary Edwards, County Manager Miro Chavez, our County Health Officer, Dr. Abdulmalik, and our Director of Public Health and Social Services, Shelley Slaughter, and a range of staff members for items today. Calling this meeting to order, is there a motion regarding the agenda, proposed agenda?
That's me. No. Motion to approve the agenda.
Is there a second?
How about now, second?
Yeah, there we go. Been moved and seconded. Call for the vote.
Commissioner Mejia,
Aye.
Commissioner Edwards,
Aye.
Commissioner Menser,
Aye. Motion carries. Agenda is approved. Is there a motion regarding meeting minutes from April 13th, 2021?
Motion to approve the meeting minutes from April 13th, 2021.
Second?
Been moved and seconded. I'll call for the vote.
Commissioner Mejia,
Aye.
Commissioner Edwards,
Aye.
Commissioner Menser,
Aye. Motion carries unanimously. Meeting minutes are approved from April 13th. Next, we have a proclamation, and this is a special proclamation regarding Nurses Week, which May 6th through the 21st. Is that correct? Or is it 16th through the 21st? That's a long week.
Good afternoon, Commissioners. My name is Shelley Slaughter, Director of Thurston County Public Health and Social Services and Administrator of your Board of Health. And it is my pleasure and honor to ask the Board of Health to proclaim May 6th through 12th Nurses Week. Each year around the world, nurses are celebrated, starting on May 6th and culminating on International Day of the Nurse, and also Florence Nightingale's birthday tomorrow, May 12th. I am so happy to have so many of our public health nurses joining us today. Not only are our public health nurses, our medical reserve corps nurses, our healthcare nurses, hospital nurses, school nurses, long-term care facility nurses, home visiting nurses are there for us every day of the year to provide care and compassion. To many of us, they are the very first ones that we see whenever we are in need. And in addition to what they do every day and their dedication that they have to their profession, this last year has been tremendously challenged with the COVID-19 pandemic. And nurses everywhere have stepped up to serve on the front line, whether that has been responding to COVID-19, doing case investigation, contact tracing, caring for COVID-19 patients, or administering vaccines, as many of our nurses are doing so today on the front line and cannot be here because of that. Our nurses deserve our appreciation and recognition. And I'm so happy to introduce to you all of our nurses with us today, and to accept this proclamation is our own amazing, incredible nurse extraordinaire, Gretchen Toller, manager of our maternal child health program, who would like to say a few words. Gretchen.
Thank you, Shelley. Yeah, what a year to be a public health nurse. We have so many great nurses that we work with, and just have done amazing work this year, just gone above and beyond at every turn. And just a little bit about public health nurses. They focus on population health, offering special attention to prevention and intervention, which is key. That's why a lot of us are in public health, is we want to prevent things. So they draw upon valued experience and their education, and work to ensure that all populations, especially the underserved, have the opportunity to reach optimal health. And they do this by using a variety of skills that have all been called upon for this year, including doing COVID case investigations, as well as other communicable disease investigations and management, testing at COVID sites, and vaccinating our community, making sure that families have items that they need that helps them with their well-being and their child's well-being. So all of these nurses just have been juggling so many balls in the air and are doing things like, driving diapers out to families, getting formula out to families, taking time to get Mother's Day cards out to families, to moms who otherwise may not be recognized, and then turning around and working a vaccination clinic the next day, or going out on a strike team. So I just want to say a huge thank you to these nurses. They are truly just phenomenal people, and so happy and so proud to be able to work with them, and just want to stress how much we value them and appreciate them. So thank you all for all that you do. Do I have time to introduce people?
Yes, you do.
Okay.
Please do.
So I'll start with Amy Longmire, and Amy has just been all over the place this year, doing COVID testing, doing vaccinations, strike teams, you name it, NFP. And then Jillian also just stepping up over and over again with many different hats. Kathy Sherman, Kara Powell is new to our team, I think since November. So I was so happy that she's part of our team and jumped in at a really challenging time into public health. And then Amelia Grube, also just an amazing nurse and going above and beyond to make sure families have what they need. So Lisa Johnson, she's not a nurse, but she supports all of our nurses. So I have to give a shout out for her too. So just a huge thank you. And I'm so grateful to be able to work on a team with everybody here. And thank you for all you do for our community.
Commissioner Edwards, anything?
Yeah, I want to pontificate just a little bit.
Got it.
On behalf of nurses in general, not only our fine nurses that are in our employ. I know Gretchen's heard me talk about that, 30%, 100%, all that kind of stuff, and how much I appreciate working with kids and making sure our future is secure. But I've got a little different perspective on nurses and medics and corpsmen and combat nurses and different things like that. I can't tell you how many times, well, I've actually been put back together a couple times by nurses that made the initial patch up or whatever. But I will say that many, many times in my law enforcement career, I was out on the scene of an accident, for an example, or some other traumatic situation. And lo and behold, there was a nurse, just showed up out of nowhere. I don't know if a nurse has ever driven by an incident that I've been involved in over a 40-year lawman career, in which, I guess I'll never know if one went by and didn't stop, but boy, it happened quite often where I was in a bad situation with a person that was seriously injured. And they parked their rig. Sometimes they didn't always park so good, but anyway, they'd park the rig, jump out, and really lend a hand and make a difference on whether that person was going to survive or not. So I know you guys have all kinds of incidences that you interact in, but you're unsung heroes in my book, and many others. I want you to know that. The law enforcement profession for sure, and fire service has been helped so many times by uncompensated nurses that have stepped forward. Thank you all.
Commissioner Mejia.
Thank you.
Can't hear you.
Unsung heroes is so true. This past year has definitely tested everyone, and especially you and your field, to the very max, and you have gone above and beyond your call. And, for that, it's just, I'm so grateful to each and every one of you. First of all, for working here and just going towards the call of vaccinating all of our community and doing it in such a great way. I've seen Gretchen at a couple of the vaccination clinics where I've stopped by, and I've seen just how wonderful she treats each of our community members, and it's been such a wonderful experience. But just thank you, to all of our nurses here and that work here, and to all of our nurses in our community who are just going above and beyond every single day.
Thank
Thank
you so
you.
much.
Yeah, well, I don't have anything really to add to what my seatmate said. I agree with 100% of all of it. And you guys are a shining light to the county. I mean, there's very narrow areas where as commissioners, we hear positives from the community in terms of what we're doing, because it's just not people's nature to pat us on the back. It's, to complain about problems. But your team is one of the areas where I hear kudos to coming to the public health department, coming to the county. And that always makes us, we love that. So keep doing it. And I know you guys have had a challenging environment. I can't imagine all the different challenges that have confronted you over this last year. And we understand what a marathon this is. The vaccine clinics, for example, have just been, have gotten nothing but good reviews from everywhere I hear. But your day-to-day work has changed, and we understand that. So this is a especially meaningful year to do this proclamation. And if Commissioner Mejia is ready, I'm ready to have, County Manager.
County Manager.
Now that I own the frame.
Yeah.
Thank you. This past year during the pandemic, I believe shifted the paradigm of many things. And from my point of view, shifted the paradigm as to what or who we consider first responders. And the definition during this pandemic of first responders is you. All of you, what you have done, what you continue to do, with the selfless approach. The only objective that you have, at least in this last year, and your normal duties, is helping somebody else. Helping somebody else beyond yourself, beyond anything that we can put in front of us. So I can probably thank you every day for everything that you do. It will not be enough. I just express my extreme and deep gratitude for you to be part of this wonderful team, for everything that you have done, continue to do, and will do. Thank you.
Thank you, Ramiro. Commissioner Mejia.
Okay. So proclamation, National Nurses Week, May 6th through 12th, 2021. Whereas the American Nurses Association has declared 2020 and 2021 as the International Year of the Nurse, a nod to nurses' sheer number, more than 4 million in the United States. And whereas thousands of nurses work in Washington state, including nearly 84,000 registered nurses, licensed practical nurses, and advanced registered nurse practitioners, including staff nurses, nurse educators, school nurses, public health nurses, long-term care nurses, nurse managers, and nurses in many other practice areas. And whereas the Thurston County nurses represent the front line of disease prevention, health promotion, and achieving optimal health in most health systems, including public health, especially as we fight the global COVID-19 pandemic. And whereas now, more than ever, we need to support and recognize nurses for their contributions in crisis and for their ongoing roles in meeting the needs of patients and their communities. And whereas nurses are public health heroes who make our community safer and healthier and contribute to our community as advocates, educators, and providers of critical health services. And whereas Thurston County nurses are committed to serving our community 365 days a year and support many vulnerable individuals and their families with a caring and competent presence. And whereas Thurston County nurses' contributions are considered crucial to the delivery of effective, high-quality care with positive, lasting outcomes. And whereas nurses improve the quality of life in our communities through their tireless efforts to educate, support, and provide important resources to their patients. Now, therefore be it resolved, the Board of Health hereby proclaims May 6th through 12th, 2021 as Nurses Week in Thurston County and calls upon all residents, communities, government agencies, faith groups, medical facilities, elected leaders, organizations, and businesses to celebrate nurses' accomplishments and efforts to improve the health of our residents and show our appreciation for Thurston County's nurses, not just during this week, but every opportunity throughout the year. Adopted this 11th day of May 2021, the Board of Health. Yay.
Thank you very
Commissioner.
much.
Thank you, Gretchen, Kathy, Jillian, Amy, Amelia, and Kara. Thank you for being here. Okay, let's move to item 3, public opportunity for the public to address the Board of Health. I can't see the boardroom. I assume there are.
No, none, sir.
Okay. Well, before I
Nobody
go
in
through
Zoom. Let me check the conference call just in case.
Before I go through the rules of engagement, let's make sure there's somebody to engage.
Good afternoon for those members of the public who have joined us via conference call this afternoon. If you would like to provide public testimony before the Board of Health, please unmute yourselves, state your name, where you reside in the county. You have 4 minutes. None, sir.
Okay. Then we'll go straight to item 4, 2021 Thurston County Health Rankings.
Thank you very much for your time today. I have a presentation, if it's okay to share that with you all.
Yes, ma'am.
Can you see my screen?
Yes.
Thank you very much. So to start with, I would like to thank you all for your time in having me here today. My name is Marianne O'Garo, and I'm a senior epidemiologist with Thurston County Public Health and Social Services. And today I'm sharing with you some information from the 2021 County Health Rankings for Thurston County. And the information I'm sharing with you provides a view into some information we look at annually as a Public Health and Social Services Department that connects to some of our planning and thinking and keeping on top of what's happening in Thurston County's overall population health. And we'd like to share with you some good news and some areas for potential improvement. To begin with, I'd like to share with you a little bit about the county health rankings, what they are, what they mean, and a little bit about this particular effort that goes on nationally, actually. The county health rankings are an annual effort that is a partnership project of the University of Wisconsin Population Health Institute and the Robert Wood Johnson Foundation. That was an effort created actually almost 10 years ago to take a look at a range of data indicators that could give a feel for every county across the entire United States of how healthy are you, and a way to measure the healthiest county within each state. So you could take a look at how you're doing, and the concept kind of underneath it was that place matters, where you live matters. And this is not necessarily news to you in any way, but that concept as a local elected official and as decision makers and policy makers, place matters. It has powerful influences in what you can change to make a difference in health. And with that, it's very empowering to be able to look at your local data and look at how you compare on a range of measures to see how you're doing, because health in this particular model that we're going to look at conceptually is influenced by a couple different things. Behavior, health services, what you have access to, social and economic conditions, the physical and built environment. So physical environment would be water, air, built environment, housing. Health is also influenced by genetics, but 4 of those things in particular are quite modifiable. So the concept of this particular model is that improvements are completely possible if you're focused and use what works. So using what works are policies and programs that have some promise, some scientific basis, some meaningful way of changing your place, your community, your county's health. So, oops, sorry, wrong way. So they created this model that has been in place for quite a while, and Thurston County reflects on this, as well as Thurston Thrives, to take a look at how we're doing and just reflecting on what's going well and where we can have some improvements. So this model, when you look at this, there's a green section called health outcomes. So these are the ultimate, how are we doing today? How long are we living? What's our quality of life? And there's a lot of detail to this that I won't go completely into today, but it creates a score and a rank that I'm going to show you in just a minute. They also create a way of, if we're looking at how are we doing today, what's our score, how healthy are we as a county today, they also want you to be able to look at some factors, those blue areas, things that drive that ranking, things that you can modify, things you can change. And so they lay out a range of things and measure those things so that if we want to change our ultimate health outcomes, how are we doing in those things that make a change in how long you live and how healthy you are while you're alive? And so in 2021, when the annual health rankings came out for Thurston County, so today's health, big picture, the way that they do this is they measure all of Washington's counties, so there's 39. Number 1 would be the best, the healthiest on all the measures that they use. So you'd want to be number 1 or as close to it as possible. Thurston County ranked 8th healthiest. So that's an improvement for us. We moved up from 9th in 2020. So that's good. That's something that we want to see. We want to see progress from that angle. I did include, just in case you're a curious person, which I know a lot of you are curious, you would have asked, what was the healthiest county in the state, and what unfortunately, where did they score 39? So the healthiest county, according to the rankings model in 2021, San Juan, so Western Washington. 39, Ferry County, that's Eastern Washington. But we were really pleased that we moved up. So competitiveness is part of the model. They'd like you to encourage you to think about every effort you can take to move up. But as I shared in that model, one of the kind of things that they include in this model is these ultimate health outcomes. How healthy are you, and how long you live, and your quality of life are influenced by all those blue areas that I showed you, those factors, those things that drive those ultimate numbers. So they also give you another ranking. How are you doing on those things that ultimately affect length of life, how long you live, that quality of life? And you really want to see a good number here, because ultimately this is something that you want to see some positive. This is tomorrow's health. This is how healthy we're going to be in the future. We ranked 6th for health factors, and this is staying stable. Again, I've provided you with the other counties, and so you can see what the other rankings for the county that scored the best, and this county that scored 39th. But I want to break it down a little bit further. So this is kind of a summary of, if you took the different ways that they look at this. They have this overall rank of 8th. Great, we moved up from 9th. Length of life is a sub-factor that we get to look at. Quality of life, sub-factor, not too bad. But those health factors is really, really, really what we want to hone in on when we look at this model, because those are some of those actionable items that we always want to just take that temperature every year and see how we're doing. So those areas of health behaviors, social and economic, clinical care, physical and built environment. You can see there's some variation in there. And this is what I want to, in my time left with you, want to share with you. Thurston County in 2021, a little bit of detail around those health factors, and give you a little view into where we're seeing some pluses and where we're seeing some areas that we could use a little bit more work. Some of the areas that we could use a little bit more work that the data from the county health rankings is showing us. And it's not that we're not doing work, but still more work and more focus and effort is still needed. So it might be keep on, do more. Tobacco use. We are still, and you have been very supportive in this, tobacco use and vaping work in Thurston County, we are still needing some work in that area. According to the county health rankings and our local data, when I look at it, what we're seeing with youth, we still need to be doing some work in there. Obesity being at a healthy weight, still some work needs to be done in this area. When it comes to sexual health, sexually transmitted infections, though we have in some years been doing a little bit better, that is starting to go a little bit in the wrong direction. We need to keep our eye on that and keep some focus in there. Some good news, the physical activity numbers, which connects to your obesity rate, is making improvements. And I know this county is investing time, energy in physical activity related things, trails, parks, different things. Good news. The physical and built environment, that rank is low. It's been low, and that may be very disappointing when you look at kind of the challenges that we're facing, the challenges we face around housing cost burden, quality of housing, work we're doing around air quality, climate change. We just need to keep working on this. Water quality, commuting is one of the areas where COVID has obviously changed commuting, teleworking, but that was an area we were not doing well before the pandemic. One of the things I just wanted to share with you really quick is just this particular sign. As you may recall, last year the Board of Health took action by passing a new smoking and vaping public places ordinance. And this is the sign to support behavior change that is ready for placement for youth-oriented places to go in playgrounds and parks. And the reason I shared this with you is when we think of health behaviors, we often think of things that people do, but often health behaviors are supported by the policies of community organizations and other organizations and the things we put in place that shape behaviors. And so this is an example of Thurston County definitely working towards supporting healthy behaviors. We just have more work to do. Another area, social and economic conditions. We, before the pandemic, we were actually still seeing challenges in some unemployment and employment areas. That was an area where some improvement and work was needed. We were seeing some very positive things, and you would appreciate this in the public safety area. Lower violent crime rates was definitely one of our pluses for Thurston County. In the area of clinical care, some of the pluses for Thurston County is having a lower uninsured rate, so more people had access to health care. The caveat to that is that not having access to health care for anyone is something that is incredibly concerning and something we continue to work on. We were seeing and would like to continue to see improvements in immunizations. We were seeing improvements in immunization rates, particularly around flu, and that was something that this model took into account. One of the areas, though, that this particular model showed and is true and has been consistent is preventable screenings is something that Thurston County, though we have access to health care, For a good chunk of our population, preventable screenings like mammograms, those kind of preventable screenings, we are not seeing high enough rates of folks taking advantage of that. And so in watching my time, but wanting to share with you just something to consider about the model, we do know some of this data was collected pre-pandemic. We know that this particular model will take into effect for the 2022 rankings how COVID has impacted the data indicators. They will take that into effect. And so when 2022 comes out, we will have that integrated into our county rankings. But I would also say one thing that we acknowledge is that when you drill down and look below some of these measures, we know there are gaps. There are equity gaps, and we completely acknowledge that. And there's work to do within many of the indicators, even if at the high level they look better for Thurston County than other places. But we definitely have some good news. We definitely have some work to do. And with that, watching my time, I'm not sure if Shelley has anything she'd like to add, but I really appreciate you letting us share with you that we've moved up to 8th, and we would like to keep moving up and addressing equity across the entire county. And this is where you can go find the complete detail. The County Health Rankings website is here. And with that, I will close up.
Commissioner Edwards, any questions for Mary Ann?
No, just thank you, Mary Ann.
Commissioner Mejia?
No, thank you. I'm excited that we've gone up. Is it one spot? We were 9 last year, is that correct?
Yes.
So that's pretty great, especially during a health pandemic.
I'm curious if you happen to know, like because the area where we are the lowest looked like physical and built environment, and embedded in there was water quality. I mean, air quality I can kind of imagine because you've got the data you can compare from the different, like ORCA and different air quality organizations. Water quality seems a lot more complicated. Do you know what they look at to assess that? What data they're relying on?
I would have to pull it up for you, and we can get that for you.
Okay, we can talk. I mean, I'd be curious.
I actually know that.
Okay.
All right,
Kumar.
So what they do is they're looking at public drinking water system violations. And so what happened, it's either yes or no. And somewhere in the data set that they use, which is an EPA data set, we had a public water supply that had an exceedance. And so that's what they look at. It's public drinking water systems, and it's an exceedance of a federal standard, which means it could be a bacteria problem or a nitrate problem or something like that.
And I mean, since this is the county overall, I mean, that could happen in Olympia or Lacey or Tumwater, right?
It could be anywhere. I actually looked at their data set today because I'm always curious when I see these things. And it goes to an EPA database that actually has access to the state's data system, which looks at all the hundreds of public water supplies within the county. And so, as you've indicated, it could be a small little Group B water system, or it could be a big municipal water system. Any of those that had a violation, though, would get a yes, which would say that we have that basically that we could be making improvements.
So as far as what the water quality component, that's it, a yes, or you either had an exceedance or you didn't, and that's the extent of the.
Yeah, that's correct. And it doesn't talk about how many parameters are out of whack or whether it's 15 water systems or 1. There was a water system that had an exceedance or violated a standard. And so that's why that we have a check mark in that column.
Got it. Okay. Any other county manager, anybody? All right, thank you, Mary Ann.
No, sir, thank you.
It's a good reminder of that issue. Let's go to our next item, number 5, emergency ordinance amending Article 4 of the Sanitary Code.
So do you want me to go ahead? Okay, so Shelley's nodding her head, so I'll do this.
Yep, go for it,
I'm
Art.
Art Starry. I'm the Environmental Health Division Director for Thurston County Public Health and Social Services. And we're bringing to you an ordinance that would extend expiration dates for a variety of septic system related permits in Thurston County. And so as the board knows, in March of last year, when the coronavirus pandemic hit, the department or the county commissioners declared an emergency. And shortly after that time, the Board of Health acted to adopt an ordinance that extended the expiration dates of certain septic system permits and some other things that aren't really part of this ordinance. And they extended those for 6 months. And then again, later on in October, as the pandemic continued and the first ordinance expired, the Board of Health acted to adopt another ordinance to extend permits. So permit application dates, or the application dates of permits, the expiration dates of other types of permits, but they're all related to septic systems. And that ran until March 31st of this year. Unfortunately, the pandemic's continuing, and the Board of Commissioners adopted an ordinance to extend the emergency or the pandemic emergency till the end of October. And so what we're bringing to you today is an ordinance that would continue to allow the Board of Health, or where the Board of Health would continue or extend the expiration dates of septic system permits and applications. That includes repair permits, on-site sewage system applications, and the like. And so that would continue that through September 30th of 2021, and it would take place automatically. People wouldn't even need to come in and ask us to do that. It would just allow them to extend that. And I know that in previous discussions about this, you'd asked if someone had come in to pay a permit or extend a permit. In the meantime, would we be able to give them a refund for that? And that's something that we can do as well. So this is a pretty straightforward ordinance, and we're asking that you approve this. And again, it would extend the septic system permits extend the expiration date for any septic system permit or application that took place between March 12th, 2020 and September 30th of 2021 until the end of September, or until September 30th of 2021.
Okay, we have reviewed this on previous work sessions. Are there questions though at this time for Art from the board? I'll start with Commissioner Edwards.
No, sir.
Okay, Commissioner Mejia?
No, sir.
Okay, I don't either. Is there a motion?
Yes. I would move to approve an ordinance amending Article 5 of the Thurston County Sanitary Code to extend the
Article 4.
4? Oh, just kidding. I will redo this. I just failed the Roman numeral test. Okay. Move to approve an ordinance amending Article 4 of the Thurston County Sanitary Code to extend the expiration dates of on-site sewage system installation and repair applications and permits as a result of the emergency due to the COVID-19 pandemic.
Second.
Been moved and seconded. Any further discussion?
Yes, sir.
Okay, go ahead, Commissioner.
It doesn't say in the motion, but what is the extension date? What does it go to, Art?
September 30th of 2021.
Does that match our declaration of an emergency? Do you know?
Your declaration, I believe, runs through the end of October. We've extended this another 6 months, so that's where that date comes from.
Okay. And we could do it again if we had to, couldn't we?
You can do this yes.
Okay, thank you.
Okay, I'll call for the vote.
Commissioner Mejia?
Aye.
Commissioner Edwards?
Aye.
Commissioner Menzer?
Aye. Motion carries unanimously. Great. Okay, that brings us to item 6, Public Health and Social Services Lakes Monitoring Programs.
Okay, that's me, and let me share my screen. Hopefully that'll work.
Go ahead and introduce yourself, Jane.
Oh, sorry. I'm Jane Mountjoy Venning, Thurston County Environmental Health. Hold on just a second. That's set up. There, does that work? You can see it?
No.
I have it on paper, but it's not on the screen yet.
Oh, it isn't?
No.
Okay. Hold on. I'm not very good at screen sharing. Just a sec. What are you seeing?
Not just the regular Zoom lineup. Nothing's changed.
Oh. Oh, I see. Okay, share.
There we go.
There. Now let's actually make the right thing.
Now we see your calendar.
Yeah, that's boring, huh? There. Now, do you see the right thing?
Looks good.
Okay. Phew, sorry. I'm Jane Mountjoy Venning, Thurston County Environmental Health, and I was here to talk about our lakes monitoring programs. We have 3 major programs that we do on lakes. So one is our ambient program, which is for regular long-term monitoring. Let's go back. I have too many screens, so they're coming up. There we go. So ambient lakes program, which is regular long-term monitoring. The next is algae bloom response. And then the third is the county swimming beaches. So I'll go into more details about these. The purpose of the programs is really to identify any problems that are occurring, being able to have the information in order to provide accurate and useful data to advise the public, and then be able to track trends over time and determine program needs. So keep that in mind. So I'll start with the Lakes Ambient Program. Again, this is long-term monitoring. We currently monitor 13 sites on 10 different lakes. Some of the lakes act more like 2 lakes or 3 lakes rather than one big lake, such as Lake St. Clair, Lake Lawrence, and Long Lake have different sections. So they have multiple sites on those lakes. So there's the list of where we monitor. This program gets underway next week. We monitor once a month for 6 months each year during, again, the summer months. I recently did a presentation for Lake Lawrence Lake Management District, so I have some specific slides to help illustrate what we do, and it pertains to Lake Lawrence, though this happens on all these 10 lakes. The ambient program happens out in the deepest part of the lake. Again, Lake Lawrence has 2 sites, and the big section and the small section of the lake. We have a variety of parameters that we look at. We collect samples from the top of the water to the surface, as well as down towards the bottom, and then we take measurements through the water column every meter, or the really deep lakes every 2 meters as we go down the water column. And this gives us, again, data to help the lake management district and others kind of figure out how to best manage the lake. It lets us look at trends over time, gives us a heads up if there's issues that we should be aware of. So some of the results from that is that we produce a water quality report each year. Again, this is from Lake Lawrence, and this is showing the information from the water column. And what I love about this is, can you see my cursor when I'm moving it around?
Yes.
Okay. This one on the left is showing the lake in June, and this is when the lake is stratified. So this blue is dissolved oxygen, this is temperature. So it's obviously warmer and more oxygen up at the surface. Down at the bottom, the lake really kind of forms these layers. And so the very bottom of the lake gets, kind of runs out of oxygen after a time. And this is the phenomenon that also then allows the phosphorus that's in the lake bottom to come into the water column. Then the graph on the right is from September, when things have warmed up enough and the stirring of the lake from the wind and whatnot, the lake has turned over. So you can see, again, this, the red line, the temperature line, it's much more even throughout the lake. There's now oxygen down at the bottom. This also brings up nutrients that are now released into the water column and distributed throughout the lake. My little thing back. We take nutrient samples again at the surface and at the bottom of the lake. So in the large sections here of Lake Lawrence, it's hard to see, but this purple line down here is the action level set by the state of Washington for the surface total phosphorus, which is this dark red line. So again, ambient monitoring is long-term trends, and you see that this graph goes back to 1998. Most of the time, it's been, except for 2013, the phosphorus levels at the surface have been above the action level, which means that the lake is at risk of having algae blooms, and indeed, Lake Lawrence does have frequent algae blooms. The dotted line is the bottom phosphorus levels. There isn't a standard or an action level set for the bottom, but we like to collect that because that gives information, again, that can help with management activities. This is the smaller section. Again, this dotted line is the action level. And again, the surface phosphorus has been above the action level most of the time. And my computer's acting very slowly. Hang on a minute. It's not moving forward. There. Another thing that we do is measure the clarity or the transparency of the water using a Secchi disc. And this graph is, again, one that's over time that shows that year's clarity compared to the long-term average. So for the last, since 2014, the clarity has been below the long-term average quite a bit in 2019. We're still cranking out the numbers for 2020's report. So again, reduced clarity can lead to, or can indicate that there's a lot of algae or nutrients in the lake that can cause those blooms. And indeed, that brings us into the algae monitoring program. So the ambient program happens once a month very regularly, 6 months of the year. And the toxic algae monitoring is not a regular thing, or it's not anticipatory, it's in response. So we wait until we hear from a lake resident or a lake user that there appears to be an algae bloom, and then we send staff out to collect to have a look, and if it looks like algae, then we'll collect a sample and send that off for toxin testing. That keeps us pretty busy. Last year we responded to blooms on 10 different lakes, issued advisories for 3 different lakes, collected over about 60 samples. I would say that Long Lake last year had a horrendous algae bloom. They had thick algae for a good part of the summer and continued on into the fall. So that's our program. The state is in the process of updating the protocols for when we post which signs, and we're going to be doing away with this white caution sign in favor of a sign that can be left up at the lake year-round that gives people information to help them decide about, the fact that algae can be a concern and what to do if you see it, and then wait to post the yellow warning sign when we have confirmed toxins, and then parameters around when to do the lake closed sign. So once that's finalized, we'll get those new signs and get those posted. There's some of the concerns. So algae, the fact is that algae can have toxins, and algae and toxic algae is the term we tend to use. The more official term is actually cyanobacteria, or sometimes you hear it referred to as hazardous algae blooms or harmful algae blooms. So we can use those interchangeably, even though they're not exactly all the same thing, but close enough. So the algae toxins that we have in our lakes, we tend to have the neurotoxins, which is anatoxin A, so nervous system toxins. We also have the liver toxins, which primarily is microcystin. So those are both of concern. There's ongoing research about this, and we're learning more all the time. The algae can also, because it's growing so thickly and as it dies, it can deplete the oxygen in a lake or in a water body and cause fish kills or other issues with, like, a lack of oxygen. It can also smell, like last year at Long Lake, it smelled horrible. You can have taste issues. So example, Summit Lake, when we've had some algae outbreaks, people commented that they did taste an off taste in their drinking water prior to the outbreak. So those are some problems that can happen. And it is a frustrating thing for all concerned that scientists don't know yet what causes the algae to become toxic. It's the very same species of algae can just hang out being algae and then for unknown reasons become toxic. So we don't have any way of telling whether it's toxic or not by looking. And we can't tell, like, a really bad algae bloom may or may not be toxic. Something that doesn't look bad at all can be toxic. So you really have to get that lab test to find out. So you can find out, again, by contacting us, going to our website, calling us, or going to northwesttoxicalgae.org. And what's cool there is they have the long-term graphs and charts showing the various lakes and what we found over the years. So again, using Lake Lawrence as an example, we've had advisories on Lake Lawrence most years from 2010 to 2020. There's a couple that we didn't have, but even in those years, toxins were detected just below the level of concern. So it can really be an impact on the people wanting to use a particular lake. Is, you know, if you're having a bloom or a toxic algae situation every year, that really impacts how often you can get in the water. And a note about our dog that's swimming here is the algae toxins, like any toxin, the smaller the body weight of the individual or the animal concerned who's susceptible, the bigger the impact. So we worry about kids, and we worry about all of us, but we worry particularly about kids and dogs. Dogs, of course, go swimming in the lake. They may lap up the water, then they lick their fur afterwards. So that can be a real high dose of toxins that they get, and there have been dog deaths in the state from toxic algae. So that is a concern. Next one.
I'm sorry, can I ask a question?
Sure.
What happened in 2012?
2012, we apparently didn't get any reports or we didn't respond to any algae blooms at Lake Lawrence. Other lakes we did. I can't say specifically what happened. Again, we do rely on people contacting us for us to go out and collect a sample.
Okay.
And then our third type of monitoring that we do for lakes is the swimming beaches. Thurston County has a variety of swimming beaches. So Kennydale County Park is our swimming beach on a lake. We do monitor that once a week during the swim season. We also monitor Burfoot County Park, which is not a lake, it's saltwater on Butt Inlet. We do that with Department of Health and Ecology funding. Fry Cove County Park, we are currently not monitoring. We have at times had funding from the state to do that, but they don't have enough funds right now for us to do Fry Cove. And it's more muddy out there. It's less of a swim beach, and it's in a pretty clean shellfish area. So we prioritize Burfoot Park for our monitoring. Long Lake Park is a Lacey Park, and it is monitored. Their swimming beach is monitored by Lacey. Miller, Sylvania, and Tolmie State Parks are state parks. Miller, Sylvania has, I think, 2 or 3 roped off swimming areas. To my knowledge, they are not currently monitored. A couple of years ago, I had a discussion with them, and they're not monitoring. They kind of assumed we were, and we said, well, no, we don't have the budget. We'd be happy to, if if you want to give us a budget, we'd be happy to do that for you. But that has not moved forward at this point. And then Priest Point Park actually has a permanent swim advisory, but the water there is monitored by Surf Riders, which is a local nonprofit. It is used, people certainly go walking and wading in the beach there, and people may do paddle boarding and kayaking and things like that. So that is monitored. And the swimming beaches are monitored every week, close to shore where people are swimming, and it's monitored particularly for bacteria and then for clarity. We don't do all the same parameters that we do out in the middle of the lake. And then a lake's presentation would not be complete without a note about Summit Lake, which is, as you know, the drinking water supply of many of the residents who live around the lake. I think over 400 residents who live there. And it is a vulnerable water supply. A lake in general is a vulnerable water supply. And then it has had the antitoxin blooms at times, a very severe one in 2017. So that's a place that we do have concerns about. I think that is all. I do have a couple details. I guess you want to know budget costs. And the ambient costs, it costs about $5,400 per site per year. So that's, if we wanted to add sites, that's what we'd be looking at. For the toxic algae sampling, the state funds the costs of the labs, the lab fees to test for toxins, and the county pays for the staff time and the shipping to send the samples off to the lab. So we budget about $9,000 a year, again, depending on other people to pay the lab costs. If one wanted to go out to a private lab and have that work done, it would cost about $175 per test per toxin, or you could get a special deal group rate for about $400 for the set of 4 toxins that are most common. And then our swimming beach sampling, we focus that during the swim season, so kind of late May, early June through August, in some cases through September, depending on the weather. And that costs about $5,500 per swim beach. And again, part of that's covered by state grants, and part of it is our own funding. Any questions?
Yes.
Let me stop screen sharing. How do I do that?
Please.
Going back to page 4, that's the one with the picture of Lawrence Lake with an LL1 and an LL2.
Yeah.
Are those locations where you do the testing?
Yes.
And then you go out in a boat each time to do this, I take it?
We do.
Are you testing those areas because they're shallow or deep, or what?
The ambient is done at the deepest part of the lake. So we look for a spot in the deepest part of the lake, and then note that and go back to that, as close to that same spot as we could figure out each time.
As you're doing that, are you testing the upper column, like near the surface, and then down at the bottom?
So the instrument that we have, we put down, and 1 meter at a time, we stop and take measurements for things like the temperature, the dissolved oxygen, the pH, conductivity, all that. The transparency using the Secchi disc is from the boat, and you drop that down until you can't see it anymore, and note how far that went. Similarly with the color's done at the surface. Then the nutrients, the phosphorus and the nitrogen, we take a sample from the just under the surface and from just off of the bottom of the lake. We have a special, it's one of my favorite instruments. It's also real old school. This instrument that that goes down and gets the bottom, and you pull on it and it closes up, so you get the bottom of the lake water.
Do you average it out somehow, or just keep track of that individual column location?
No, we keep track of the individual columns. So remember that graph that had the lines that went crooked one time and went straight the other time?
Yes.
That's showing it through time. So let me see if I can get to that one.
And the reason I just happen to know that lake because I've been out there. So,
a few times maybe, huh?
But like where that LL1 is.
Yeah.
There's about 10 feet of muck there that you can't sense it if you poke a stick down in it, for an example, because it is so loose. And so I've actually pulled, there was a sawmill on the lake shore at one point in time, probably 120 years ago or so. And there's no oxygen in any of that muck because you can still pull slab wood out of there and it's still yellow, like when it was cut on the mill, you know, when it was shipped in. And then within about 3 or 4 hours, it turns dark gray as it gets oxygen. But what I'm getting at, the reason I mention that is because there is no oxygen down in there, and that's how come those boards don't ever rot. So I don't know what you're actually getting, but in these older lakes that have a lot of unusual sediment that wouldn't be there in a 10,000-year-old lake, but it would be there in a lake that had sawmills and the river was run through there for years for the power plant as well. So I just wonder if you're taking into consideration that extra contamination that's there that you wouldn't find maybe in another lake. And I'll say Lake St. Clair or maybe Summit Lake.
Mm-hmm. Well, we collect the sample before we hit all that muck. And sometimes we miss it and we hit the muck and you can feel that, or when you pull up the instrument, you can see it's mucky. So then you have to go, you know, to the other side of the boat or somewhere else and try again. So we get that information, the water samples about a half a meter or so off the bottom. And then the oxygen and all that through the water column. So you can see this side is the depth starting at 0 and then going down. So yeah, when in early summer, there's not much oxygen there at the bottom of the lake. By September, lake is mixed, and this is the oxygen scales up here at the top. So you have, you know, you have more oxygen. It's more oxygenated throughout the whole column. Down in the muck, probably not so much, but in the water you do.
On your $5,400 per site, apparently you do use some volunteers. You use that surf riders group or something at one of the locations. Do you coordinate with, we have 2 lake management districts. No, we actually have 3, I guess, if we, over here on the west side of Olympia. But do you utilize those folks that are participating in those organizations to help you offset maybe the cost? They could help you take tests or anything?
For the AMI program, not so much, in that the equipment that we have is pretty specialized and very expensive. We had to buy a new one last year, and I think it was about $15,000 or $20,000 for the instrument. So we don't like to lend that out to volunteers. We do, you know, we coordinate, and we, like I gave the presentation to the Lake Management District. We provide them with the data and that aspect. One of the things I've thought about that might be a role for the county, we haven't moved into doing this at this point, but would be to host a training each year for the, not the ambient program, but the swimming beach sampling to, let's see if I could, that's enough, to train. So there's many neighborhoods that have a neighborhood access at the lake. And you know, their own neighborhood HOA swim area or swimming beach, to perhaps offer a training for those groups that wanted to monitor their own swimming beach for bacteria. That's fairly simple to do.
Okay, Thank you.
Jane, I have a question about the ambient program. So you do this testing and you gather this data, and then what happens? I mean, you showed the graph, and it seemed like for a lot of years it was Lake Lawrence was an example, was just a tiny bit over the what you call the action level, and then it looked like here in the recent years it's gotten quite a bit over that level. And what does that mean, action level? What's the action?
There's not a required action to take, but it's that point where if you're getting over that, you might want to look at lake management activities to reduce the phosphorus, because that action level is set at a point where you're likely to see algae blooms if you go above that. So we can see that we have had algae blooms, for example, at Lake Lawrence and many of our lakes.
So what do we do to try to reduce activities that cause the phosphorus? I mean, is that just an information campaign, or does that trigger some action on the county's part to respond to those elevated levels of X, Y, or Z?
Well, Lake Lawrence and Long Lake have lake management districts. So the way that the county has chosen to do this thus far, is my understanding, is we ask the citizens living around the lake or owning land around the lake, which includes the boat launches. Fish and Wildlife pays into these and forms lake management districts. And then those lake management districts take actions to work on management activities that can help the lake one way or another. So again, Lake Lawrence and Long Lake are county lake management districts managed through Public Works and the weeds program. So they do activities to reduce the weeds that are growing in the lake. I guess Long Lake this year is going to be applying alum treatment to help tie up the phosphorus, so that might help with the algae blooms.
Jane, you still have your screen up. We're looking at your calendar.
Oh, that's boring. I don't know where the button is to make it go away. Well, how about if I at least make something pretty come up instead of my calendar?
Okay, so Paula with Public Works, in advising us about the two lake management district and Black Lake, I think, have all come up in discussions with her, and she's talked about I won't get the terminology just right, but there's something about the structure lake, eutrophic or something, or they're shallow, and they basically, what she described, and this was in with respect to Black Lake, was that like 2/3 of the problem was for phosphorus was going to exist regardless. If there was no human activity whatsoever, it was going to be there as a problem because of the nature of the lake. It doesn't cycle through or whatever. And then 1/3 of the problem could be attributed to human activity. It sounds like maybe that's not the case on all of the lakes, that those are specific to those particular lakes, and other lakes maybe it's more connected to human activity. Or how do I understand that, like lake to lake? I mean, we're just talking about Lawrence and Black, but there's a lot of other lakes. You've got 10 lakes and only 2 or 3 of them have a management district. The rest of them are in our hands, right? The county hands.
Right. So if you really wanted to get into in-depth looking at the nutrient loads of each lake, you would need to do specific studies on each lake. So we have baseline long-term data that gives you a good start to that, but you might want to do more in-depth work per lake to better understand where the nutrients are coming from. So as Commissioner Edwards said, some of the lakes are fairly shallow and have had history of sawmills and whatnot on them, have a lot of nutrients down at the bottom of the lake. Quite a few of our lakes have a lot of nutrients at the bottom of the lake. Not all of them. Some of them are really, really deep. So how much of the nutrient is coming into the lake from surface water runoff, or from, groundwater flow into the lake, and how much is there in the sediment, you'd have to look at lake by lake. So to get into that level of detail is a more in-depth study than we do in our monitoring.
The 10 lakes that we do ambient monitoring on, are those the 10 biggest lakes, or are those the 10 lakes with the most people living around them? What puts them into the category of us monitoring those 10?
Yeah, good question. They are lakes that have public access, that are highly used, have boat access, swimming access, etc. So and then it's a resource issue. There are a few other lakes that fit that category, but they didn't prioritize. Maybe they're not used as heavily as the ones on this list. I will say Hicks Lake, actually, the county doesn't pay for. Lacey contracts with us to monitor Hicks Lake.
Is there a lake on the list that's like really suffers in terms of, if we had all the graphs for all the parameters for all the lakes, and we were looking at kind of what you showed us for Lawrence, is there a lake that's really not doing well in what terms of water quality that you're from the ambient analyses that you guys do?
Mm-hmm. So long-term analysis. Well, this issue of the different lake categorizations. So lakes are categorized as eutrophic, mesotrophic, or oligotrophic. I don't think I'm saying that one right. So the eutrophic lakes are very nutrient rich. So it's not necessarily that it's poor water quality as far as, say, the fish go or the critters living there, but it becomes typically not a great lake for humans to use that much because it's got lots of growth in it. And we tend to like really clear lakes without much growth for swimming and boating. So our shallower lakes tend to be more eutrophic. Our deeper lakes, not so much. So I don't know if that answered your question quite well enough. On
Did we freeze up?
I think Jane froze.
It looks like she was studying something on the screen or something. I was giving her a moment.
Chair,
Okay.
could I have follow up on that?
Yeah, go ahead.
Okay, sorry.
Well, like
froze up, Jim.
one of the bigger lakes that we don't apparently monitor, and that's at Clear Lake up in the Bald Hills. And that's got a development all the way around it. And there's no problem with the water up at Clear Lake. And it's never had a sawmill.
Yeah, they get algae blooms pretty regularly also. We do go up and we'll do algae sampling on any lake.
Yes, yeah. But it is a
do
deeper lake, and so it ends up being a healthier lake. I mean, if you look at the deep lakes compared, but all the shallow lakes that have had sawmills, it's just about no fixing it with, they just pumped as much slab as they could. The slab they couldn't burn in their hog burner, they pumped out into the lake along with all the sawdust. And that's what's built up in many of these shallower lakes around that are, I guess, in closer to civilization. And, that's a problem that we're never going to get ahead of if we don't, do something about the nutrient in the lake. That's the bottom line.
Mm-hmm. Well, yeah, and I would say deep lake, which is not really all that deep, is where Miller-Sylvania Park is on Deep Lake. Mm-hmm. That one is fairly shallow. I don't know if it had a sawmill on it at one point, but it has had toxic algae blooms, not as frequently as some of the other ones. Summit Lake, because it's a drinking water source, is a pretty high priority lake because it's not just recreation, it's people's water source.
we could have quite a discussion on lakes if you wanted to.
Yeah, we should.
I would look
I'm
forward
running out of time.
to more discussion, but it's already 5 o'clock.
Okay, well, thank you. I think we kind of run out of time. But that gives us food for thought and further questions and discussion for sure. Anything else before we move off this topic from the board?
Well, just one quick comment. I'm looking forward to a staff briefing that's coming up about what we can do about the lake management districts and how we could help. Because I believe that the lake management districts are the answer to us improving our water quality. I know there's only 3 now, but there could be 10 or 12 of them. Those people would be involved and do something if we would help them instead of hurt them in the process. So just a little plug for the next upcoming briefing. Thank you.
Okay, thank you, Jane.
Thank you.
Let's go to item 7, Board of Health members, health-related activities and accomplishments. Commissioner Edwards, anything to report?
No, not really. We're getting there on the testing, getting there on the shots. So looking forward to getting over this. I still get calls about vaccines and why if my kid had the virus, why does he have to get the shots and all of those kind of things. So my phone is ringing almost daily about virus issues. I'll just let it go at that. Thank you.
Commissioner Mejia.
Yeah, same, just been answering questions. I actually volunteered at a clinic this Saturday. I was a traffic coordinator. I didn't do much of the trafficking. I really socialized. So, you know, but it was a good turnout. It was 76 people that showed up. So it was a good event and it ran very smoothly.
Okay, thank you. I don't have much to report. Some health-related, pandemic-related meetings through WASAC as the counties try to coordinate our policies and some information sessions there and some random stuff. Had a meet and greet with some new folks that are involved with healthcare insurance issue and Capital Medical Center and multi-care and that changeover in the community about what the vision is there. So that was an interesting informational meeting. With that, I'm going to ask for the health officer's report. Dr. Abdulmalik, been waiting patiently, listening carefully, I'm sure.
Good evening, commissioners. I know it's the end of a long day, so I will do my best to be brief. I do have a few important things to report. One is that COVID-19 transmission has continued to increase in our county, and we crossed the threshold on the governor's roadmap to recovery today of 200 cases per 100,000 over the past 14 days. So we're currently sitting at 202.5 cases per 100,000 over the past 14 days. We are continuing. Our test positivity rate is 8%. It has been hovering between 6.8 and 8% over the past week. We are continuing to see hospitalizations, and we are continuing to see deaths in folks who have been severely impacted by the virus. While most of these deaths are occurring in folks over the age of 60, we have had a few deaths, including folks in their 30s, 40s, and 50s. And just a few days ago, actually had a death in somebody who was in their 40s. So this continues to be a significant challenge. I would like to encourage everyone in Thurston County to keep up doing all of the things that we've been doing since the pandemic began: masking, distancing, staying home when sick, and getting tested. We are at a crossroads, and we are, and it's really essential that we do everything that we can to protect our community, which leads me to the most hopeful part, which is the availability of vaccine. So we do have there is a lot of vaccine in our county that is available. We here at Thurston County Public Health and Social Services have been able to register folks on site. So that means that folks are able to show up to any of our clinics that are public and register on site. No pre-appointment necessary. We have many clinics scheduled pretty much every day of the week. We have something going on, at least for the next week. We are watching closely we are excited about the FDA approval of Pfizer for the 12 to 15 year old age group. It does have to be, so we're waiting for the Advisory Committee on Immunization Practices and the CDC to issue their recommendations, as well as the Western States Pact Safety Advisory Committee to issue their recommendations as well. But we anticipate that those will be coming in the coming few days. But to date, in Thurston County residents have received 218,724 doses of vaccine and of eligible residents. So 16 and up at this point, but we are definitely excited about the FDA guidance on Pfizer. But of folks currently eligible, so 16 and up, 52.54% have at least of folks in our county have at least initiated vaccine, with 41.08% of folks who are eligible in our county having completed a full series. So 2 shots of Moderna, 2 shots of Pfizer, or a shot of Johnson & Johnson. We are continuing to see variants in our county. And as of May 5th, which is the last published report by the State Department of Health, in Thurston County, there were 27 cases of the B117 variant, and that is the UK variant. 2 cases of the B1351 variant, which is the variant first identified in South Africa. And 2 cases of the B1427 variant and 15 cases of the B1429 variant. Those are both California variants. We are continuing to watch this situation. We are continuing to watch the situation closely. In other news, we in our department have followed up 72 cases of various communicable diseases. It's not all COVID. So Campylobacter, chlamydia, giardia, gonorrhea, psittacosis, shigella, in addition to tuberculosis and Yersinia, just to name a few, in addition to our efforts with COVID-19. We currently are providing direct observed therapy to 4 tuberculosis patients in our county. Another key thing that I'd like to mention is rabies. So the second positive animal case of rabies in the state this year was found in Thurston County. So there was a bat with rabies that was caught by a cat. So I just want to let everyone know in our county to stay away from bats. Don't touch wildlife, especially wildlife that appears to be sick. To keep pets vaccinated, and to make sure that our houses aren't attractive dwelling places for bats and other animals. By closing off entry points, to attics, outbuildings, under the eaves, places where animals might make their home. And if you have an exposure or concern about a potential exposure, feel free to call the health department for further instructions and support. While rabies is, if untreated, is almost universally fatal, it is preventable even after exposure with immune globulin and vaccine. So it's really important to get on that quickly as soon as an exposure occurs, and we are here to help. And with that, I am open to any questions you may have. Thank you.
The county manager had his hand up about something.
Dr. K, can you please repeat the numbers of vaccination, the percentages? My pen wasn't quick enough. How many, the percentage of who initiated the first dose of Thurston County residents versus those who have completed the cycle?
So what I have are the folks that have that are eligible. So 16 and up, currently eligible. 52.54% in Thurston County have initiated vaccination, and 41.08% of those eligible in Thurston County have are fully vaccinated, have completed a series.
Okay, thank you.
Doctor, didn't you say that 218,000 have had a shot?
218,000 doses of vaccine have been administered to Thurston County residents. So folks that have a 2-shot series are represented twice in that number.
Okay. Are you still taking questions?
Yeah.
What do you find when you do your tracing on someone that has been tested that came down with a variant? When you have one person that has been tested, came down with that variant, and then you do your tracing, are you finding others that have the same variant, or do they maybe have COVID but not a variant? What do you come up with?
So not every sample. So that's a tricky situation. So a lot of what we're doing. So a lot of what we're doing is surveillance, because genomic testing of the virus requires a specific type of equipment, and you have to have the right sort of sample with enough of the specimens still on it and viable. So not every sample, even if we suspect, can be has enough high quality specimen to be tested. So what we are finding though is things that trigger our suspicion for variants are because the variants that we have are more transmissible than the virus that we were than the virus that was circulating in our county before. So the B117 variant is about 50% more transmissible, and the B1427 and 1429, so the California variants, are about 20% more transmissible. So the approach that we're taking, in addition to the sampling that the state's doing of 5 to 10% of all specimens, is we're looking at when we see an outbreak situation that has like a lot more people involved than we would expect, then we notify the State Department of Health and we work to see if there's a sample that is suitable for testing to see if a variant might be involved, or if somebody ends up being sicker than we would expect. So at a younger age or without comorbidities, those are other, in addition to like, any possibility that there was transmission between a human and an animal of SARS-CoV-2. So that's how we're monitoring for the variants. It's hard to tell, just because of the variances in specimen collection and kind of the limitations around how many samples can be tested for any one situation, whether everybody who is a close contact and becomes sick has the variant, but we would suspect that would be the case. So there are some studies that the state's doing, and so they can actually trace the variants from, and they'll even know like how many times sometimes the variant has been introduced into a population. So it's a little bit of there are some technological limitations, just in terms of how much can be done at any one point. But yes, we do see clusters of folks that are affected by a single variant.
How many folks that either have passed away or were admitted to the hospital did not have a comorbidity issue?
So off the top of my head, I don't have that number. I know that there have been a few that did not have reported comorbidities. So it's definitely not 100%.
It's not 100%, okay. And then I guess, why don't we spend more time trying to encourage people to be healthy so they don't have comorbidity issues? Why don't we put a little emphasis into that, trying from a preventive maintenance standpoint, encouraging people? I don't know how you want to do it, but it just seems like that is where the problem is. I mean, there might be a few that passed away without a comorbidity issue, but I think it's very, very, very few. And if we could do a little focus on wellness and get through to some thick heads, that maybe we could do better that way, or at least help. Is there any talk amongst the medical professionals about trying to do that? You know, keep your resistance up, get enough rest, lose weight, take your supplement, vitamin, and whatever. Do you ever work on that?
So
you don't have enough time, probably, huh?
So we do value wellness and preventative measures, including having a varied, nutrient-rich diet, exercise, as well as engaging in a lot of the preventative health activities that we know help people stay healthy over time. And I agree that things that help people stay healthy in non-pandemic times are just as important, if not more important, during pandemic times as well.
Okay, thank you.
Thank you, Dr. A. Shelley, time for the director's report. Mindful that it's 5:22.
Thank you so much, commissioners. I will try to keep this report as brief as possible. I do want to just say thank you again so much to all of our presenters today, and especially all of the nurses that joined us. Many of the nurses on the screen today are part of our maternal child health program, which includes our nurse family partnership program, as well as our children with special needs program. And in addition to all the great work that they have been doing to support our vaccines and COVID response, they delivered 317 visits to families in need over this last month. And we continue to work on making plans for resuming in-person visits for those that are at the highest risk in our community. Tacking on to Commissioner Edwards' question of Dr. Abdimalik, education and prevention is a core part of what we do. And as you heard in Marianne O'Garro's presentation early on our county health rankings, we greatly invest and focus on prevention programs that improve the health and well-being of our community. And that's one of the reasons why we score so well in health behaviors and factors. But of course, we do have a long way to go. One of the things that is very important to us is addressing the severe mental health needs of youth, young adults, as well as older adults in our community. We are partnering at Thurston County Public Health and Social Services with Choice Regional Health, Family Education and Support Services, and many other nonprofit organizations, healthcare organizations, and behavioral health providers in offering QPR training, question, persuade, refer. This is a suicide prevention training. You've heard us talk about it before, but I did want to just add on that we are so proud that we are able to fund and sponsor an upcoming Train the Trainer program that will enable 20 local participants from throughout our community on May 24th and 25th to become trained in this program and train others so that we can give people the support that they need during these challenging times in the pandemic. Our opioid response task force has been working really hard to update the opioid response plan for Thurston County. The Board of Health will be seeing this come before you in August, but in the meantime, We have work groups that are working really hard in updating that and doing lots of fabulous work. There are meetings this month, including our prevention groups and pregnant and parenting, that have finalized and released an opioids and teens webpage. So we encourage members of the public to check that out on our Thurston County Public Health website. We have also provided opioid overdose and naloxone rescue kit trainings in workplaces, and are doing a pilot of school-based training with our ESD 113 Nurse Corps. Recommendations from the pilot site will be used to make changes to school-based trainings. We'll incorporate that into future programs in our schools. We also launched the first ever Public Health and Social Services Living Well with Chronic Pain workshops, and this filled up to full capacity. This workshop started this month, runs through late May, and will continue through June. So we encourage anyone who's interested in that and future chronic disease self-management programs, which again, really important for preventing those underlying conditions that can put people at risk for things such as COVID-19. Please check that out. Our amazing business team at Thurston County Public Health in the past month has reviewed over 50 different COVID requirements and guidelines that have changed in association with phase 3. We are available to support members of the business community and others in help in interpreting that guidance so that people can have safe events, gatherings, and conducting their business. If people need help, they can contact our business line at 360-867-2634. And then finally, I really want to highlight the amazing successful partnership that we have with United Way of Thurston County in operating our COVID-19 vaccine sites. We would not have been able to administer that many doses without all of the support, the incredible volunteers. And I just want to highlight some of the numbers that we have for our last month. So in the month of April, we had 1,342 volunteers from United Way that provided 7,827 hours of volunteer time to support our COVID-19 vaccination efforts. To date, we've had 2,332 volunteers provide 13,426 hours. We're so grateful to the volunteers, and I just want to share a couple of their comments, and then I will close my report with that. So here's some quotes from volunteers at our site over the last month. Volunteering at the vaccination clinic has given me a way to battle this pandemic, a way to contribute to the solution even though I have no medical skills. I'm helping save lives, and that has really helped give me a renewed sense of hope. I had such an amazing experience the first time I volunteered. I took a couple days of vacation time to volunteer 2 days this week. I left feeling so happy, and the tears, gratitude, and hope of those thanking me for what this organization is doing for our community is no feeling I will ever forget. I moved cross country alone to the area in February 2020. I haven't seen a single loved one since the move or had a hug. I missed my goddaughter's birthday, spent my first holiday season alone, and shed many tears. My time volunteering to be a tiny part of this momentous global health effort felt extremely cathartic and filled me with hope. I will be able to tell any future offspring that I did my part to keep others safe and help when I could during this terrible time. I've done a lot of this is the last comment here. I've done a lot of volunteering with many local charities over the years, but this is one of the best run events I've volunteered at. If you're hesitant about getting your vaccine, these clinics are a great opportunity. Convenient drive-through service, a smooth system to get you served quickly, a built-in observation period for safety with medical staff on hand to immediately help with any issues that may arise, all while helping protect yourself, your family, and your community, and helping us get closer to getting back to our regular lives. And with that, I will say anyone that would like to volunteer, please visit unitedway-thurston.org. Thank you again to all of our amazing volunteers Please stay safe, stay healthy, and get vaccinated.
Thank you, Shelley. Keep up the good work. Thank you, Dr. A. Thank you, commissioners. We are adjourned. Yeah. Commissioner Edwards, you have
No,
something?
Shelley was going to give me some numbers on the demographic on the.
You got it, and is in your email.
Oh, it is. Okay, good. Thank you, Shelley.
All right. Thank you.
Okay,
We're adjourned.
thank you.